any cuts, then you put the cup by the pump. Then when you wait and you see there are no blood, you didn't remove it and make other cuts. You just leave it. So this place, I want to talk about that in the other slides. This place, if there are no blood, so it's safe. The next, he or she does a second section to draw out a small quantity of blood. You might get 3 for 5 cups in your first session, or you might just try 1 to see how it goes. It's rare to get more than 5 to 7 cups, the British Cupping Society notes. Afterwards, you may get an antibiotic ointment and bandage to prevent infection. Your skin should look normal again within 10 days. So we continue the video. I told that if the skin it's not normal within 10 days, then the therapist has did a mistake, or he put the cup on the skin for more than 3 minutes. Uses of cupping. The British Cupping Society say that cupping therapy is used to treat blood disorders such as anemia and hemophilia, rheumatic disease such as arthritis and fibromyalgia, fertility and gynecological disorders, skin problems such as eczema and acne, high blood pressure, migraines, anxiety and depression, and bronchial congestion caused both by allergies and asthma and varicose veins. Side effects. So cupping therapy, yes, have side effects, but when it's do it in a false way. Cupping is safe as long as you go to a trained health professional, but you could have these side effects in the area where the cups touch your skin: mild discomfort, burns, bruises, skin infection. If the cups and equipment become contaminated with the blood and aren't sterilized correctly between patients, blood-borne disease such as hepatitis B and C can be spread. A note that the cups are used once. When you must have not cupping during pregnancy, during period, if you are under 14, for older people, patients suffering from different chronic disease such as vascular heart disease and diabetes. The cupping's contraindication. So there are many things that you must not do it if you want to do a cupping. And you also must to tell your patient before do the session of cupping. So any effort that increase your cardiovascular system activity, like sport, shower, or sexual intercourse, I think at the same day of the session of cupping. Also, sauna bath, massage, or dry cupping. Getting a shower after the session may increase your chance to get an infection because they are cuts, and for the effort and the massage or bath, because it's contraindicated because they make the blood circulation move, and we don't want to make the blood circulate. Having a big meal and dairy product. You can come to the session after 3 or 4 hours after meal, but not hungry. Extremely hot or cold weather. Note: you can do the session anytime during the day, but it's recommended to be in the morning because of high level of cortisol inside your body. What indications give you the color of blood? When we are doing the wet cupping, we must look at the blood, the color of the blood and his type. So if there are no blood or thin red blood, I tell you before in the other slide that if we do the cuts and put the cup, and we finish, and we didn't see a blood, so it's seen in a normal cases. The organ is normal. Also for thin blood, red blood, black blood, it indicated a middle or toxicity, maybe in some organ. A black blood clot, it's severe toxicity in some organ.